Hi, I'm Kim. I'm an emergency nurse. I work at Hackensack University Medical Center in Hackensack, New Jersey. I've been a nurse for about 4 years now. When Krista asked me if I ever faced a bioethical issue, I faced them a lot, but there's one that just stuck out. It was one day in January. I remember I was going to work. It was very cold, and I just had a feeling it wasn't going to be a good day. I don't know why, just had that feeling. And I went into work, and the morning was okay, everything was fine, and all of a sudden, I still remember it so vividly. The emergency personnel come running through our doors with a patient in the stretcher, and I just knew it wasn't going to be good. My charge nurse came running up to me to help out. We quickly assessed the patient. It was a 34-year-old who got into a serious car accident with some head trauma, internal bleeding. We knew he had to go into surgery, and he was going to need blood because his blood was very, very low. His wife was at the bedside. She came running in, and we informed her that he was going to need a blood transfusion. Of course, that involves consent. So we asked her if she could sign for him, and she refused. So confused, we asked why this was very important for him to be able to live, and she informed us that he was Jehovah's Witness and they don't receive blood transfusions. So as a nurse, of course, being an advocate for my patient and always wanting the best for them, this was very hard. But at the same time, we need to respect beliefs, and this was a certain instance where I had to, and even though I wanted to help him, you just have to respect people's beliefs. So that was a hard issue for me to face, and as well as my healthcare team. So that was the one issue that I remember. Being a new nurse, of course, that really stuck in my head. I'll never forget that.
The United States Supreme Court has determined that a competent person has a constitutionally protected liberty interest to refuse medical treatment. The court concluded that the U.S. Constitution would grant a competent person a constitutionally protected right to refuse life-saving medical treatment. This includes nutrition and hydration. Jehovah's Witnesses firmly believe that the transfusion of blood will result in a loss of eternal life based on interpretation of biblical passages. Witnesses do not accept transfusion of whole blood, packed cells, white cells, or plasma. However, many will permit use of dialysis or heart-lung equipment. If the use of fluorinated blood substitute becomes available, this practice would be acceptable to witnesses. In addition, organ transplant is not specifically prohibited. Transfusion can be authorized over the patient's objections if there is question of the patient's competency, or if the state demonstrates a compelling overriding interest, or if the refusal is not concurrent and informed. Therefore, transfusions may be authorized in Jehovah's Witnesses who are not competent adults, have dependents, or are pregnant, or in those for whom there is reasonable doubt of the strength of their religious convictions. These patients or their families should be advised in advance of the pending transfusions. Jehovah's Witnesses will sign standard AMA forms that legally relieve physicians and hospitals from liability associated with their care. Most carry a medic alert card. Both documents are binding on the patient and protect the physician.